Hi, I'm Dr. Joan Friedman. I hope you all had a wonderful Thanksgiving holiday, and now we're gearing up for the next holidays. It's going to be a lot of busy months and busy families traveling and possibly doing lots of really fun things during the holidays. Lots of times when there's so much going on, there's a lot more potential for conflict in families. And this is understandable and it can definitely be worked through. But I'm struck when I work with twins how conflict is so difficult for many of the twins that I see in my practice. Because for twins, especially, the idea of conflict isn't just getting upset with someone, it's the idea that you could get so upset and so angry that you could absolutely run the potential of your twin abandoning you or threatening you not to talk about again, never to talk again. So there's all these tremendous fears that go along with dealing with conflict that may not happen exactly with singletons. And I'm always struck by the situations that my patients talk to me about. Um, and basically, there's a lot of feelings about, well, if only their twin would talk to them about these issues, if they could talk it through, there would be some possibility of getting to some sort of resolution. And in many cases, these clients of mine have tried, but they haven't been successful for one reason or another. And then basically, what it means they need to do is to sort of move on and try to understand the conflict, try to accept it on some level without the, enormous drive or need or motivation to make their twin understand and then ultimately agree with them about what they're upset about. And I've seen this countless times with identical twin women, identical twin men, is this reluctance to give up the fight, even though they've tried, even though they have maybe made efforts to talk. It hasn't worked. And so the idea of having to work this through on their own keeps them, I think, from working it through because they so much need to feel like they want to blame the other person, they want to change the other person, they want to have the other person admit all the wrongdoing that the angry twin feels. And ultimately, that's not going to happen. And they've seen that it doesn't happen when they've had these confrontational kinds of meetings and it doesn't work. So the idea of having to work this through by themselves, which is what a lot of people have to do. It's like, and if you're in couples counseling with a partner, a lot of the times you do have to figure out a way of understanding yourself and understanding them and reaching some capacity for acceptance about how things are rather than to keep on wanting the other person to change. It's a very hard place to get to, but ultimately, it's probably the most rewarding and it's the most peaceful. And you can definitely feel that those patients who are able to do that become less reactive, they become more patient, they become more conciliatory, and they stop fighting the fight, which gives them a lot more energy to direct toward things that are much more pleasurable. So, I would appreciate your listening. Thank you, and I will talk to you next week.